Chair, the issue of detention. Number one, we don't detain women in facilities. It is the waiver period and process that takes a bit of time. And that is what we are refining. Because you find people ultimately, and you've been a governor, facilities cannot run if payment is not made. And that is why we tell people, please register on SHA. Register on SHA so that you can be covered. But you see, also for long is a cost because you have to feed them. They're taking others would have taken. But imagine if everybody who says they can't pay is released immediately. All facilities will collapse. Chair. If people had the option of not paying, they will not pay. Even those who can pay. So, Chair, we have a waiver guideline, we have a process of waivers, partial waiver or full waiver, that hospital by hospital we do. Chair, when I go to those hospitals, and the CEOs will tell you, even those who could, all the women, they come running and they say, oh, Governor, tumekwama hapa. Sometimes it is not true. They say there's been there for 3 months, it is not true. For them, I pay. Francis Chair, I don't put it on media. And I think people should stop carrying cameras to hospitals. You're going to see someone in a hospital bed, you're there with their camera, you're looking at their leg. It is very indecent. It takes away the decency, of that patient and the dignity of that patient. You must respect their dignity. So, Chair, that's the waiver system we have. We will keep on doing campaigns for health insurance because health financing is a critical aspect that this country needs. And I'll tell you an example. Today, in my level 2s and 3s, my primary healthcare facilities, I think I'll invite you to come to Embakasi South or Embakasi East. You can go to Tasia. We can go to Kwande, what do you call this? Kware dispensary. Kware is now level 2. All my hospitals have assigned, you walk in and walk out. If you're not registered, we register you there and then. Because PHC fund, imagine that hospital that was just like 2 containers is getting 1.7 million shillings a month at the minimum. The PHC is working perfectly. The problem we have is on the level 4s and 5s because of the SHA reimbursement that is taking a bit of time. But for the lower levels, and many people are also not being told, and I'll ask the SHA team, I think I saw the senator here, the CS here, and the CEO, to explain to people that you don't go directly first to the level 4 or level 5. Because those who go there are the ones who say SHA is not working. Because it is based on a referral system. You start at the lower level, and then you're then guided on where to go to. Those who do that have a seamless experience. I know people who've been paid for 300,000, 400, 180. In fact, the number of harambes that we are being put into for health have actually gone down drastically. So, Chair, on the issue of bed capacity, again, a city of 7 million people, the bed capacity required is tremendous. But I keep telling my CEOs, they have become victims of their success. People are coming to our hospitals because they know that is where they're getting good care. And that is why they're flocking in there. So we're continuing with infrastructure improvement, building more wards, hiring more doctors and nurses because you must give that care. But the policy is you cannot turn away a patient. If a patient comes, you cannot tell them, no, the beds are full. Please, and that person is maybe even critical, or they're about to give birth. Do you turn them away? You don't. But the turnaround time is high. And that is why, for us to prevent that, those who have been cleared with are discharged as soon as is possible. We have those infrastructure projects. I have shown you Mutuini, which is going to have a huge bed capacity. Is it 300 or what? What is it? Mutuini? Mutuini, which is Mama Rachel Ruto. Mutuini will have 400 bed capacity. Mama Margaret is also big, 425. Mama Lucy, this facility that my senator was talking about, is adding an additional 120. And also there's another 300. So we're expanding. What I would ask for the support that Nairobi County needs. Chair, in the same way, we saw that in education, Nairobi needed affirmative action. That a county like Nairobi from 1992 had no new school built. With 7 million people, had only 210 primary schools. You can compare with your county. You know how many primary schools you had, because My guest of honor on that day was a former MP from Eldoret, was in Gishu, Eldoret, no, former Eldoret North MP, who is the president currently. And he said when he was an MP, he had 150 schools in his constituency. Nairobi with 17 constituencies had only 210. The same affirmative, and because of that, they did affirmative action in the budget, added 1 billion every year for 3 years through the members of parliament to build classrooms. It's the same way Nairobi would require affirmative action to increase bed capacity in public hospitals and public hospitals. Beyond that, we will have the same story of women sharing beds. We increase the number of beds. We cannot turn them away, Chair. Chair, I think that generally covers
maybe one
issue of
question,
capacity.
because I visited Mbagathi and your CEO is here. There's a very big facility that was left by COVID in Mbagathi that was not in use. Bwana CEO, is it in use? Ama sasa umengoa?
Honorable Chair, it's not in use. We engage the public health sector, and that space has been condemned. But we are putting it into a better use of a center of excellence in maternal and child health.
Okay, Senator Onyonka.
Thank you.
Thank you, Chair. Governor, my question, I don't know whether Chair I'm preempting what you wanted to raise. I'm just interested to know, how has your FIF performance been? Has it been increasing? And in your responses to the questions I've heard, which have been asked, I just heard you say the national government is doing this and this. Other than the constructions you've done and the projects that are standing, how much is your FIF helping? And as I said, has it increased? Is there a variance and that kind of thing?
Senator Amida.
Oh, no, Chair, you realize, I think, Nairobi, I think it's long overdue, Chair. I would just propose for us to go for inspection, simply because just to support all that. And you remember, even these questions, actually, I think we haven't seen Gava for some time, because I mean, these were since 2024. But one more thing, Governor, there was a motion that went through, my motion on postpartum depression, I mean, having a mental health wings. We've gone to many hospitals, and I think, of course, Nairobi being one of them, that you find mothers who they have lost their babies in the same wing with the ones who are breastfeeding. It's really, they fall through, I mean, they go through depression. So mental health issues. And I said, I'd requested, the postpartum depression who are going through that, can we have a separate wing for them in every, county for them? And then number 2, yes, inspection. Then one last thing, Governor, let's take advantage. I think we've been having even many investors who have been interested to build hospitals. I don't know whether they've approached you. So in case we have, and maybe we have been having many proposals on that, why don't you take advantage? At least the legacy for you in Nairobi, it's healthcare. Health is wealth.
Yes,
so let's take advantage of that.
Governor, 1 minute response.
Thank you. Chair, I agree with Senator Hamida and also Senator Onyonka. Number one, we have to be creative. There are many partnerships that we've sought now. We're working with the Swedes or Novo Nordisk guys for the Danish, sorry to their country, on the issue of diabetes. And you'll have a center of excellence. The first research hospital public research hospital is going to be Mbagathi, working in partnership with Kemri. So that even these who are doing great medical research can do their clinicals within our hospitals. Chair, if you look at Mama Lucy, now it has an annex in Umoja that is the first public eye hospital where we're even doing admissions, we're doing surgeries. That had never been done. We're manufacturing the spectacles from there in Umoja too. And I would wish you come see it. There was an old man, and I always give this story. 91-year-old, he had not seen for 50 years. He went to Umoja 2 when we were launching. We gave them 1 month of wall-free services. He regained his sight. And he started saying, I'm not going to leave this hospital. Because he felt if he leaves that fence, the sight will go back. That he's only seeing because he's in there. And you could see him asking his son, Kumbe, you look like this. I thought you're more handsome and what, joking. And there are many such stories. Regaining sight, now you're finding people from all over the country are coming to Umoja 2. They know the matatu to take to reach Umoja 2 because of that eye hospital. I've talked about dental services that we've increased across the county and dental chairs that were never there. Many of us never went to a dentist growing up. We thought that's for rich people, you know. God has helped us that we can still smile, you know. But there's such transformation when you change governance. On PPPs, we're working on one currently in Isili. Isili, we have beautiful land, big space, abandoned facilities. Investors have come and said, look, we want to partner with you. We put up a hospital, public hospital to the level that you want, and allow us also to have our own private wing. It makes sense, you know. We need to do the same for expansion even of the Nairobi Funeral Home. Because the same quality today you're going to get at these private facilities, whether it is Montezuma or whatnot, let me not mention the brands. Today, if you go to Nairobi Funeral Home, remember the smell that was always at that roundabout. Always. It has improved tremendously. It's called Nairobi Funeral Home. What formerly known?
Is the generator working?
Formerly, there are many generators. They are working. There's even now a chapel.
Now, let's...
More radio, 88.2 FM. We are in charge.